I'm Dr. Dan Horvat, a family physician in Northern BC. I'm also co-lead along with Dr. Paul Winwood of Northern Partners in Care, a shared care initiative. And I'm an assistant professor with the Northern Medical Program. It's part of the Department of Family Practice, UBC Faculty of Medicine. So RACE is the Rapid Access to Consultative Expertise line, which we've set up as part of Northern Partners in Care. It allows family physicians to be able to call if they're seeing a patient in the office and they're not quite sure how to handle it. It's not an emergency, but they want to have a specialist kind of help them in terms of guiding the care. So they can call the RACE line, and we've got a number of specialties involved so far, cardiology, soon nephrology, and then we've got a number of other ones kind of lined up that are interested. And it allows the family physician to be able to get the expertise that they need kind of at the time or close to the time that they're actually seeing the patient. So RACE went through its first iteration of being a bit too cumbersome. We had forms that we were relying upon, and often it was difficult for people to know where the forms were, etc. So we're relaunching RACE as a far more simplified kind of version where the family doc basically picks up the phone and calls to get access to the specialist. It'll be far simpler than it has been in the past, and so it'll be far more usable. Plus, we're going to be getting the information out to family physicians better, as well as adding further services to the RACE line. The RACE work that we're doing builds on the great work that's been done at Providence. So they've got a RACE line up and running. It's been there for a while. They've got, I think, a dozen different specialties involved with it. And we may tap into some of the specialties that they have on their RACE line that we don't have access to in Northern BC. So it's a really neat kind of capability that we're developing and that's already been developed out of Providence and Vancouver. So RACE down the road, we look at it as helping family physicians to access specialist service across Northern BC, from across Northern BC. We are running right now with cardiology, adding nephrology soon, and a range of specialties that are interested in engaging as well. So I would see that we'll have a kind of 1-800 number that family physicians can call, make it easy for them to be able to remember that number and call to be able to get the kind of support that they need to deal with complex patients in their practice. So Dan, you've been doing awesome with your exercise, diet, weight loss, but unfortunately the blood pressure is still a bit higher than it should be, and because you got diabetes, we have to pay special attention to that and kind of bring it down to a reasonable level. Otherwise there's some significant long-term implications for you. So I know that it's tough for you to kind of get in here. You work out of town quite a bit. You are on 3 different medications right now. There's a 4th one that we've tried in the past, which you had some issues with. The 3 medications you're on right now, we're at fairly high dose with. And so I'm not quite sure the best way to kind of treat you from here. Normally what I do is I refer you to see one of the cardiologists, but I know given your schedule and the fact that we've actually got a new kind of service called the RACE line, Rapid Access to Consultative Expertise, I can see if I can access one of the specialists now while you're in the office, or at least this afternoon, and see if we can get this dealt with today. Okay? So let me just quickly pull this up. So it's www.northernpartnersincare.ca. All right, and just the RACE tab. So let's see, I'll just give a call here, 1-855-605, RACE, so it's 7223, and just hang on for a minute. Okay, so 1 for cardiology, and so it's Dr. Hattie that's on, and hi, Dr. Hattie, it's Dr. Horvat calling. Just have a patient in the office here that I wanted to get your advice with. If you give me a call back, that would be great. It's 250-563-0414. But so Usually the callback comes within a few minutes. It can take up to a couple of hours, occasionally longer than that, but usually it's fairly quick. So what I'll get you to do is just wait in the waiting room for a little bit, and hopefully it'll be fairly quick turnaround, get you back in here, and we'll decide what adjustments we need to make. How does that sound to you?
That sounds great. Thank you.
Perfect. So Amy, it's Dr. Hattie, line 2. Great. Okay, you can put Dan back in the room. I'll get the call. Thanks. Hi, Dr. Hattie. Thanks for returning my call. Yeah, I've got this patient in the office here, and he is 31 years old, has diabetes, reasonably well controlled. He's in pretty good shape, exercises regularly. The problem I'm having with him is he's got high blood pressure, which is insufficiently controlled. I've got him on 3 different medications that are at high dose: telmisartan 80 a day, nifedipine 90 a day, metoprolol 100 BID. And just he's been on hydrochlorothiazide in the past, and he has slightly decreased renal function. It seemed to make it worse, so we had to discontinue that. I'd like to get his blood pressure under better control. It's a bit challenging for him to come in and see you right now. He works out of town. So thanks for returning the call today, and just wanted to get a sense of what you think.
It just comes to me, Dan, did he have any further investigations to rule out secondary hypertension? Because he's in his 30s and now needing 3 agents to control his blood pressure, all of good doses. I wonder whether he has prior workup done to rule out secondary causes. So you think this might have been done some time ago when he first started? Okay. Well, if there is still concern that there's a test missing, then we can always look into investigating him further. But I agree that his current control is not appropriate, and we need to do something now. I have 2 suggestions to make here. As we talked about, is we can either increase his metoprolol, especially if he is not symptomatic, he is not having side effects. What's his heart rate? So 75. Okay, so we will not run into trouble increasing his metoprolol. So we can do that and see what he does for the next 2 to 3 months. But there has been some recent introduction to a beta blocker into the market, something called nebivolol, which is supposed to be a good beta blocker for blood pressure reduction without the side effects. It's not covered, and it's not on special authority. So do you know if your patient has his third party covered? He doesn't. Okay. I was just thinking, if he does, we can just replace his metoprolol to nebivolol. If he doesn't, then the next stage is probably start him on doxazocine. And this is just 4 milligram once a day. It doesn't matter. There is no relation to food, but he can probably take it at night. Because he's taking some other stuff in the morning. And then you're going to review your records and see if he's had extensive workup for secondary hypertension. If not, I'll be happy to see him to consider working me up for secondary hypertension. You're gonna check with him whether he has third party coverage, but you think that he doesn't. If he does, we can give him nebivolol, and it's 5 milligram. It's actually a new, even I just started using it. It's 5 milligram once a day. Increase his metoprolol to 125 instead of 100 twice a day.
We'll see if we can just take care of this for him this afternoon. Thanks a lot. Bye. So Dan, I spoke to Dr. Hattie, the cardiologist, and he was a bit concerned, given your age, that you're on that many medications, but I did reassure him that you've had a fairly extensive workup when you were in Vancouver before you moved to Prince George. There's a few options for you, but given that you expressed to me that you don't have a lot of money right now and you don't have any extra coverage, the best option for you is to take one of the medications you're on right now, which is the metoprolol, and go from 100 milligrams twice a day to 125 milligrams twice a day. How does that sound to you?
It sounds great. I'm surprised, actually. It's nice not to have to come back a second time. I didn't expect that.
I know it's hard for you to make it in, that you're on the road a lot, and so it's great that we've got this service that the cardiologist can respond as quickly as that and don't have to keep you waiting and go in for a visit with him, etc. So really pleased that we're able to do it as well. So let me get you your new prescription.
Great.